Just a reminder that the Welcome to the Waiting Room membership is alive and active, and we meet almost every Friday at noon for our general support group, and every other Thursday at 2 p.m., both Eastern Standard Time, to discuss the struggles that come along with trying to navigate intimacy while you live with chronic pain conditions, things like Ehlers-Danlos syndrome. And this one is led by Jessica Sullivan-Sanchez. She's a sex therapist here in Atlanta. And this isn't therapy, it's just a support group with education and peer support, while Jessica just kind of leads and holds space in the group. So if you have been interested in any of the work that I do, this membership is a really good place to connect more and do this work on a little bit of a more consistent basis and get some kind of direction and support around your chronic illness journey. Sometimes we are in the space of needing support around managing how much we have to do with our illness, whether that's routines and supplements and diet and exercise and medical appointments and all of those things that come along with it, while also trying to have healthy relationships and manage the social responsibility that comes along with being in relationships. So that is why I created this space. I think that there are a lot of programs out there that kind of tout a cure for chronic pain, and this is not one of those programs. But you will get a lot of support for managing what you're going through, which in my experience does help mitigate some of the intensity of the pain. But that takes time, that's an individual journey, and it doesn't happen for everyone. So I always want to be really honest and clear about that. And I do hope that you'll join the Welcome to the Waiting Room membership. The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe, while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learn here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Pamela Madsen is the founder and clinical director of Sea Change Psychotherapy in Atlanta, Georgia. Pamela is a doctoral candidate for graduation with a degree in counselor education and supervision. She specializes in treating couples and adult individuals who are overachieving professionals experiencing eating disorders, substance use, and anxiety disorders at the intersection of complex traumatic stress. She specializes in narcissistic abuse and chronic pain as it accompanies PTSD. Pamela is certified in EMDR and is trained in internal family systems, radically open DBT, and ERP. She served the local eating disorder community as president and continuing education chair for the Atlanta chapter of the International Association of Eating Disorder Professionals. When I asked Pamela what her biggest pet peeve is about how people with chronic conditions are treated, she said, "My biggest pet peeve is around the burden that clients have of constantly having to teach people about their illness and implicit bias of ableism increasing the allostatic load on these clients." And I'm inclined to agree. So I hope that you enjoyed today's episode on narcissistic abuse and what that looks like when you're living with a chronic illness. Thanks, Pamela, for being here. Would you tell us a little bit about your practice and who you work with and what you're doing these days within therapy?
Sure. So I'm Pamela Madsen, and I'm a licensed professional counselor here in Atlanta. I have a group practice in Buckhead. I work as the clinical director. I also provide clinical supervision. I'm finishing my doctorate degree right now and writing my dissertation related to narcissistic abuse. I specialized in I'm just now really saying it out loud, but it's narcissistic abuse, the adult children who've experienced it. So I see adults, individuals and couples, and they usually have a complex issue that I like to think of more of as like a coping skill, that doesn't really serve them as well as it used to. So that's often like alcohol use, an eating disorder, OCD. And then a lot of my clients also have chronic pain or chronic illness. So I really like working with chronic pain in the context of post-traumatic stress disorder.
Yeah. Yeah. Can you say a little bit more about that, about chronic pain and this context of complex PTSD?
Yeah, absolutely. So there are three types of pain. Um, One we're all real familiar with. So that's nociceptive pain. So if you stub your toe, you treat that with ice and rest. If real physical injury, you might have surgery. That is kind of a real classic type of pain. There's neuroceptive pain. And so that would be the result of maybe some kind of damage to the central nervous system. One example of that is like phantom limb. And we treat that often with SNRIs or TCAs because this selective serotonin reuptake inhibitors work on that same type of neural pathway, which is kind of a crossover into our field. But then nociplastic pain is a pain that originates in the central nervous system, and those are going to be um, fibromyalgia, um, IBS, migraines. So these are often you have clients that come in and they've kind of exhausted pain management opportunities. Um, the medications they've been given don't really work. It's really generalized, not acute, sharp pain. It's just like kind of more broad. It can move around. RAE is one, rheumatoid arthritis. So you have like it's more of a systemic algorithm that's set in the brain that creates the pain sensation. And we have people who have post-traumatic stress disorder develop this for the reason that negative emotions cause us to experience pain at an amplified rate, whereas positive emotions improve our subjective experience of pain. We've studied it. We've got proof that it has to be emotion regulated. And then the reason post-traumatic stress disorder here is so key. When somebody has PTSD, they're on high alert, very hypervigilant all the time, right? And they are scanning their environment for danger. Like we see somebody goes into a restaurant, they sit with their back to the wall. They want to be able to see the door, so they can observe everything that's going on. Then they're much more heightened state of awareness. Those people are not just scanning the environment, they're also scanning inside of their body. So they'll be hyper aware of any sensation of pain. Now, pain is normal. We're actually always taking it on. That's why, like, someone laying in a bed can develop a bed sore and not realize it was coming because the pain threshold is lower. But what you have happen is when somebody is looking for a threat, they're also looking for pain subconsciously, and their perception of pain is heightened because they're looking for the threat of tissue damage as well. And so that is where these particular disorders tend to come about. So if we treat the post-traumatic stress disorder, that scanning for danger around them, scanning internally for danger, their perception of pain improves. And we studied it, did some great studies with internal family systems and rheumatoid arthritis that showed great improvements. Other approaches that I use, EMDR is another. There's CBT for pain. But these clients, they come in and they've tried everything. They get really exhausted with it. So it's great that we can offer them that kind of hope.
Yeah, thank you for explaining that all so clearly. Did you find in any of the research, and it's okay if you didn't come across this, but were there actual inflammation markers that were different, or like physical blood markers that we see a difference in after figuring out how to find safety emotionally, even when pain is present?
Um, like as far as clinical studies measuring like physiological changes, there is a difference in cortisol levels in the blood, right? Because it is really taxing on the body to be always scanning for risk, and so we see changes there physiologically. Um, you're going to see sometimes you'll have clients that present with like OCD, and they will have physiological changes as well. Obviously, when someone is less attuned to risk around them, they can provide more self-care, so they might eat more regularly. There's a lot of factors that play into it. So, if they're managing stress with an eating disorder, um, managing their nutrition, so their connective tissues and things also get the proper nutrition needed, you're going to see overall blood chemistry improve.
That makes sense. And I always say, when sometimes people can get a little bit hung up on, especially on social media, you'll see a lot of like, this thing cured me. I was missing, like, I tried everything until this thing worked. And I think my theory on that, and tell me your thoughts, you can disagree, agree, whatever. But my theory on that is that everything else you were trying had likely had some benefit as well. This was kind of like the last missing piece. So yeah, if you never paid attention to your nutrition, but you were always doing breath work for like the last 5 years, you've learned to regulate through breath, but you still are malnourished. Then you start to nourish yourself, then of course the diet worked. Or and then vice versa, if you did the perfect diet for 5 years, but your breathing, you still were always holding your breath or bracing your body a lot, or some of these more like physical coping mechanisms that we unconsciously engage in. So you're doing the perfect diet, but you haven't done that work, then the breath work is what worked. What are your thoughts on that?
I absolutely agree. And as you were describing that, what I was thinking about is like, early eating disorders, when someone is restricting for just a couple weeks, they're not really going to show um, like vitamin deficiencies. In fact, like when you restrict, your body uses the glycogen it stores in the body 4 times like that, right? Where you can't eat but need to. But it's over time that you might start to see like profound deficiencies and osteoporosis, where the body is taking minerals from the bones as a last resort. And that can't be reversed. So, um, in these cases, you might have a sense that, oh, this was the thing that finally cured me. But in reality, what we see is just like trauma is really complex. It's like, well, anyway, the clients that I work with, it wasn't just one bad experience one day, one thing that somebody said negative to them, but it was a layering of experiences over time. And these types of clients have a core belief that they don't deserve good things. So they're typically not taking extra good care of themselves. Physically, maybe they didn't have parents that taught them about how to eat regularly, taught them about nutrition. I've heard, maybe they didn't teach them how to bathe themselves. They had to kind of figure these things out. And so you're going to have a multifaceted approach to their recovery. So it might be this vitamin supplement was the missing piece, but they had to do a lot of other things leading up to that too.
Yeah, thank you for that. And so we are talking about complex trauma today. And with that, specifically your research and your area of expertise is within narcissistic abuse. So maybe we can lay the foundation a little bit of how that even develops into growing up with somebody who maybe has the full-blown narcissistic personality disorder, or maybe even just traits that are wouldn't be diagnosable, but maybe we can just differentiate between that as well, and how that then leads to an adult who is scared of their body, scared of their world, doesn't know how to trust. You can name other symptoms, I'm sure.
Yeah, absolutely. So what we know, one of the hallmark traits of narcissism is there tends to be some antagonistic behavior. And when I think about narcissistic abuse, and always think about like the motivation for those behaviors, it really comes to like a core belief of um, if someone loves me, they'll behave and do things in a way that make me look better. Because they really are focused on the self-image. And that's actually kind of a kinder way to think about narcissistic abuse, they're people. Um, but that is their belief, is that's kind of what love is to them. That you'll behave and achieve to make me look good. You won't criticize me, you know. Um, and then there's 4 types of narcissism. There's a grandiose narcissism. This is really the classic one that I think a lot of people really think about. That's an inflated sense of self importance. There's a sense of entitlement and a need for admiration. So you can see like that self image. They're really needing a lot of recognition for being great. There's a covert or vulnerable narcissism, and this is the one that's pretty sneaky. It's hard to label. It's actually hard to suss out clinically. But this particular type is they appear more sensitive and insecure, and they seek validation through victimhood. And they still exhibit these narcissistic behaviors. You see a lot of "don't hurt me" responses. Um, don't criticize me, that hurts me. Um, so provide a lot of reassurance to them. There's malignant narcissism. This is the more severe kind, of more antagonizing behaviors. There's aggression and maybe cruelty and a lack of empathy. And then communal narcissism. And this one in particular, I think most of us know and like these people. They tend to not have their children show up in my office because they're just exceptionally generous and helpful in the community. But the goal not being benevolence instead of maintaining a very positive, grandiose self-image, right? But they're able to channel that into a way that does good things for others. And so those are the 4 kinds. And then how those affect their children can look a little different.
Would you like to explore, or would you like to kind of share how each of those types might affect a child? Like just one example, not like some, it doesn't have to be definitive, but an
Sure.
example. What?
Yeah, sure. So like a communal narcissism is probably an easy one to start with. Their parents would be like great benefactors, in the community. But maybe to a point where their own personal needs for their children aren't being met. Funds may be reallocated in other places, or the child may just not be prioritized, like parent not going to their 5th grade graduation because they had an event they were being honored at for something like that, or having to attend an awful lot of like galas and things with your family instead of being allowed to make time and plans with friends. So that's inconvenient a lot of times and can be difficult for the child, but more easily recoverable with some resiliency. Okay. The malignant narcissism, this is going to be, again, that's more aggressive cruelty and lack of empathy. These children may become like quite scared. That's coming really close toward antisocial behavior. This one tends to pick up more attention from teachers and social help. So there might be some intervention in the home. So those children actually might get more support and help than some of the other types, which can help. But they might experience like physical abuse and things. The vulnerable narcissism, like, and then this is the really sneaky one. So you've got a family system built around where one parent's needs become the center of the focus, and the children experience role reversals and are recruited to take care of the parent. So you often see like maybe medical neglect of the children because the children having strep throat becomes too taxing on the mother, who becomes overwhelmed by anyone else's needs. And they may even experience the needs of the children as an affront to them. And then this one is particularly difficult because the narcissistic parent actually appears to be really good. They're more sensitive, so they're able to experience cognitive empathy, so they can say empathic things, and outside of the family, it might appear to be like this ideal family. But on the inside in the home, it's a very different situation. And so you have social gaslighting in effect, like where you'll have people maybe in the church around them telling them how great their parents are. Your parents are like Ward and Jim Cleaver. You're so lucky. The child is the one taking care of the parents' feelings instead. And then, so the grandiose narcissism, that's real typical. Again, the child might be required to achieve greatly, be the best at sports, have to attain specific grade, because the parent sees the child as an extension of themselves. And so if the child is ever struggling, instead of being met with compassion, empathy, and like creative supports, so like tutoring, the child might be yelled at instead and told, you need to hit the books, work harder, you're grounded, instead of asking like intelligent questions to help understand what the issue holding them back from achievement is, that kind of thing. Does that make sense?
Yeah, absolutely. I was wondering too, about more verbal abuse, because in Malignant, you'd mentioned maybe this was where you might see some more physical abuse. The verbal abuse, though, I would imagine it's probably in all four. It just looks different with each one.
Yeah, it will. So like, the underlying message typically is, you're not good enough, and that keeps the child pursuing, taking care of the parent, always achieving, reflecting well on the parent. You sometimes hear, we got a little visitor here. You sometimes hear this pervasive message from these clients that they feel like they bring shame to the family. They'll often hear statements like, we handle our problems here inside of the family. We don't talk about our problems outside of the family. There's these types of family rules that show up in these family systems.
Yeah. Can we contrast that maybe with what a more functional family looks like? What might it sound like when you're not experiencing this? And I don't, maybe functional is not the best word.
Sure. Well, we can give her a classic example, right? So you've got a child that maybe isn't doing really great in a particular subject like math. A narcissistic parent might feel like the child's additional needs are on a front, become angry, tell them that they'll never get into any kind of a good college. They'll be flipping burgers or pumping gas. This is really like old school talk, right? And instead, what we might find to be more beneficial to a child would be the parent to say, assume good of their child first, right? That they're trying. Because children are a work in progress. We're always a masterpiece in the making, you know? And to ask the child, tell me about what goes on in the classroom. Is it difficult to concentrate? Can you see the board from where you sit? You know, so you're looking for like, we want to first always exclude like, are there medical issues going on? Do we need glasses? Is there someone in the class that's bullying this child? Is it just before lunch and they're not getting to eat, so their blood sugar is low? You know, you want to assume well of your child and start to suss out like, what are other issues? Because children typically aren't trying to not do good in school, especially one that's afraid of disappointing their parent, right? So you might determine that your child needs additional educational supports. So setting up a tutor to help with math, or a quiet study space. That's usually the most typical approach to these kind of problems.
Yeah, that makes sense. So moving into how this affects us long term, maybe we describe and define complex. I know CPTSD is not technically in the DSM, but how do we describe it? How do we work with it clinically? What do you think? What are you looking for when you're thinking about CPTSD within clients?
Well, most of my clients are overachievers. So they have those parents that they were always trying to make look good, right? And they don't know it because they tend to have like a vulnerable narcissistic parent, or like the grandiose classic approach. to narcissism, because they come into the office and they're like, I feel like I don't belong. They're a C-suite executive, or they're using alcohol. They're wanting to reduce that. They have a partner that's complaining about how much they drink. These are the things they come in and talk about, and they start to listen to the way they describe their family. So one of the questions I always ask early on is, "What was it like growing up in your family?" And I often hear, "Oh, we're a really great, close, tight-knit family. It was great. My parents are still married." And they'll describe like kind of a framework, white picket fence childhood. Um, and then I might follow up later, like, well, use 3 words to describe your mom and 3 words to describe your dad. And like, um, that's when the narrative really shifts. You can see their face. They try to put words. My mom, she's really controlling. It's like that didn't really sound like close and tight knit. Um, that's become like really keywords to me when I hear that. Like, tell me more about how close. What does close feel like to you? Um, Close became more enmeshed, over involved, and controlled versus emotionally attuned and safe. So mm, mm, that is the truth that my clients were taught, is that close is always involved. Um, maybe they're in contact multiple times a day. If their parent calls and they don't answer, they start to feel like they're going to be angry at them for not responding right away. Um, it's this internal message of, I'm not enough, or I need to do more to keep this person happy or in the neutral zone, not angry with me, that they most often complain about. And they won't have any idea about um, their relationship with themselves being impaired until we start to take these beliefs apart.
Which is why people think that therapy like causes the problem, because you go to therapy and you might feel a little worse when you open this up and you realize that this is happening. Yeah.
Yeah, there's a period of grief when you come into awareness that you had experienced like narcissistic abuse or emotional abuse. And then also sometimes people feel relieved to know, oh, it's not because I'm all bad or I'm a perpetual failure. But there usually is some grief that they didn't have the childhood that they were taught the narrative was. Like that was the mantra of the family. But then when they realized they actually didn't have that, that it's sad. It's really heartbreaking. That's a loss that can take a long time to process, but it's also like a new identity for them.
Yeah. Let's bring this a little bit into the experience of chronic pain and chronic illness. Because I think one of the tricky parts of the conversation with like trauma and chronic pain and illness is whether the trauma causes the chronic pain or whether it was maybe there before and then that, the illness contributed to the trauma, or I think there's so many directions from which it can start. It's a little bit of a chicken or an egg, I think. Do you tend to see kind of one presentation of that and your framework in your mind is from one presentation, or are you always looking at it from these multiple angles as well?
It's like in my mind, as my clients are talking, and in the session they'll talk for like 45 minutes and they're always apologizing after that, like, oh, I'm just rambling. But what they don't know is, in my mind, I'm making this map. I'm drawing everything out. Every piece they give me, I put somewhere. I'm categorizing it to see what is the system that created what they're coming in to work and improve on. Always with the belief that my client is striving for wellness, because they're just struggling. Whatever the goals are, they want good for themselves and a peaceful life most of the time, and to feel loved and a sense of belonging. That's what we all want, right? So there's typically some epigenetics involved. If you've got someone who is experiencing narcissistic abuse in early childhood, There's going to be some trauma if it's mom, more often passed on to the child in mitochondrial DNA. So you're going to have some, and that's in utero. So you're going to have some early predisposition to trauma. If it's the parent and the mother is experiencing narcissistic abuse from like the father, while the baby's in utero, mom's experiencing more cortisol in the blood, that can affect the baby in the development. And so genetics can change based on these contextual factors going on. And then once the child is born, that kind of stress on an infant in utero there are going to be some kind of changes to like connective tissue and things like that. Science is still coming to understand that. But you can see like all of the data and studies that we're doing now are starting to point right towards proof. Like what we have a theory about happening, it's becoming to be clear and supported by quantitative research, which is really exciting to see.
It is. It is. I think it's also a little bit scary because there's so much not within your control. That's where my brain goes with all of this. So I agree. It is exciting. But I also think there's a lot of people right now who are using this research in a way that's like, so therefore buy my like nervous system healing program and you'll be healed. And so maybe we can just talk a little bit about like epigenetics, what it means, like what it means to maybe have been in utero with a parent who was constantly stressed. And then if they were constantly stressed in pregnancy, chances are it didn't just stop when you were born, that continued to go on throughout your life. So, which leads us still, this is within the context of complex PTSD, because it's complex PTSD it's all of these experiences layered on top of each other and melding in with each other, which is, and I am like you with clients in session, it's like my brain is mapping when clients apologize for talking, sometimes it even throws me off a little because I'm mapping what they're saying. And then I have to like come out of that map and be like, wait, no, it's okay. Please keep talking. But yeah, it's complex and that's different than just trying to heal from trauma. Can we speak to that healing piece for a moment?
Yeah. Well, I wanted to like point out something. Some of the apologizing. They often come in apologizing from the get go. Oh, I'm sorry. I'm sorry I was early. I'm sorry I was late. And that is really a behavior that's typical of someone who's experienced narcissistic abuse. They're always apologizing for themselves for things because the hour with us, that's their hour. If they wanted to color for the whole hour, it's theirs. We're going to try to make it therapeutic, but if that's what they need in that hour, we're going to do it. But yeah, so I'm always fascinated by the over apologizing. But going back to the epigenetics, yeah, abuse doesn't stop once the child is born. And we see a lot of the proof here about that is, children that are born and given up for adoption or in foster care, they are going to, it's not an ideal situation to be moved into foster care, but those children have disproportionately a lot of atypical neurological presentations later. So we can see the patterns. It's there in the data. But a child that is experiencing an infusion of cortisol in utero, and then is also going to, even as like a newborn that's like sleeping a lot, right? All about being a newborn is co-regulation with your parent. So if you have a parent, mom, who is taking on abuse, emotional abuse from an abusive partner, baby resting on her chest is going to sense the tensing in her nervous system, hear her heart rate increase. Even dad. So if mom is emotionally abusive toward dad, there's like high conflict in the house. Our nervous system is going to give that away to the infant, and that's setting the algorithm for that nervous system regulation that infant is going to carry forward. What do we see when we have a child whose nervous system is dysregulated? We see like impulsivity. So a 2-year-old might be acting out, and a narcissistic parent will see that as my child is misbehaving and it's reflecting badly on me, and they respond with anger instead of my child needs a nap or a snack, or let me hold them and help them feel my calm so that we can move through this tough moment. This just how it starts out real small. You can see that belief, that one belief that you exist to reflect well on me, doesn't really work out well if you have a 2-year-old.
Yeah. If someone is listening to this and they actually recognize some of that behavior in themselves as the caregiver, what um what are some of the things that they can even start to do now that will help maybe move for themselves, but more I'm a parent, so I always think like I was gonna say more importantly the child because my mom brain is like my kid's most important thing in my life. But yeah, so I'm gonna say more importantly for the child. It's important for both people, but I also think you have such a chance with young children to rewire them at such a young age if you're doing this work. And so it might take a lot longer for the parent to kind of get to this place of feeling healed. I think you can help your child like way before you feel healed. Is that, can you speak to that?
No, absolutely. So I hear this a lot, where clients are worried that they're going to transfer these things maybe they experienced onto their kids. And the truth is, like in a restaurant, if our kid is having a tantrum, we are concerned about disrupting people around us, right? Um, and so this is a spectrum of behavior, and that isn't like a normal range. Um, if it's not pervasive and all the time. But if you are noticing it's going on a lot, the fact that you have this awareness really speaks to a strength you have. And we can work with that strength. It doesn't mean that you're narcissistic, like on a pathological level. We all have narcissistic traits, they're healthy. Um, but that kind of clues us in that you were taught that the job of a child is to reflect well on the parent. And that might have been what you were taught as a child, and you want to adopt a different role in your family going forward. If you're always worried about how other people are perceiving you, um, you're not really attuned to like your relationship with your child actually. And if a child is getting really fidgety instead of getting angry at them because they won't sit still in church, it might be fun to color together while you sit there, or help them look through a magazine or a book that they can touch and feel, so that you can attend to both situations at once. Does that make sense?
Yeah, what I'm hearing is going back to that scanning the environment that we talked about earlier, instead of scanning the environment, which you do when you're feeling unsafe, because evolutionarily, like if you feel unsafe, you are looking around to see where the danger is coming from. And so when your child is acting out in public or sitting at church or, one of these spaces where children are supposed to be quiet, um, and it's really not appropriate for them, but that's what everyone expects around us. You're scanning the environment to see what people are thinking and feeling. But if you just redirect your attention to your child, one, what I'm hearing is that that requires you to be aware of the fact that, yes, I feel this is dangerous, but I'm choosing actively to stop scanning the environment and to just maybe scan my child and be with my child. Um, and so that is an active but really difficult choice to do when your nervous system is screaming that there are fire alarms like everywhere.
Yes. And that comes from what we're scanning for is criticism. Who's criticizing me? Who's judging me?
Yeah. Yeah.
And that is truly the hallmark of narcissistic abuse, is to be ready for criticism instead of curiosity.
Yeah. I wonder too if, um, yeah, there's so many, my mind is going into so many places. There's many questions about this, because it is such a nuanced, like a layered, complex experience. So for whoever is listening to, I think it's important to just note, like, we might say something that hits a nerve or makes you think something or feel something or remember something. And we do really encourage you to talk to a therapist about who really understands narcissistic abuse in order to get a better picture, because the one thing that we say that kind of hits you may hit you in a way that we intended or didn't intend. And so it's just important to work with somebody who knows you and your specific circumstances. I always have a disclaimer on these podcasts, but sometimes I think the middle of a podcast deserves an extra one. This is a very hot topic. So, and hard topic. So it's important.
Yeah, it really is. You never know what might be triggering for someone that has this level of developmental trauma. But we always try to meet it really compassionately. That's really the only way we can work effectively with it in our roles. You know?
Yeah. Yeah. And compassion doesn't mean condoning, right? It's just looking at the problem with an accurate understanding of why what's happening is happening, and then figuring out what to do with it. Right. I think I even remember, so in my somatic experiencing training, this was something that came up over and over again. In SE training, they're very big on, which there's a lot about that, but they are very big on like not criticizing, like in your role play when you're practicing. They're very big on not criticizing and only saying kind of what you did right in order to kind of learn and do more of what's right. And people really struggled with that. Like there were people that would get mad. I remember one person in particular who got pretty upset because they were like, I think they felt gaslit in the moment, to be honest.
Yes, you're right. That is, you said that people really struggle with not just noticing what they feel like they're failing at or doing wrong. Um, and oh my gosh, that's just really some training for a way to think about ourselves we probably picked up early on from some early relationship, right? Um, and that's really how can I keep people from noticing that I'm not perfect? And that's a self-protective behavior. But it also, when we're busy like protecting ourselves from threat, it's really difficult to learn. So like when you're learning somatic experiencing, or for me, maternal family systems, um, you have to find a way to give yourself permission to be a work in progress, that and to trust like I will learn this skill. I'm just getting better at it. That way we don't have to scan for threat all the time. There's so much work to that. Like when I think about the amount of energy we spend looking for risk around us, if we have like a history of emotional abuse, it's exhausting.
Yes. Yeah. And it's also exhausting to try to retrain yourself not to look for that risk, because it is such an automatic behavior that you don't even realize you're engaging in. And so when you're actively trying to like rewire that, it feels really difficult and really unsafe. And that's exhausting to try to constantly remind yourself to kind of come back inward or come back centered. Um, and with chronic pain too, there's something you said around, I think just always like needing that perfect response, or maybe the perfect, like, and you want to know exactly what's wrong. Like, why am I feeling this pain here or that pain there? Or what is your working model with chronic pain? Is it around, do you work specifically with like pain, meaning we are actually looking at or feeling what you're feeling, or do you kind of always bring it back into the emotional, like the psycho-emotional lens?
Um, I do work specifically with pain. I provide a lot of psychoeducation about that nociplastic pain and what is the core issue around it. But a lot of this is changing our relationship with pain. And like the current definition for pain is the perception, the subjective perception of risk of tissue damage. That doesn't necessarily mean there is tissue damage. It's just the perception of risk of it. Sometimes there is tissue damage, right? But there are also those of us that, like, when we get like our blood drawn, we don't even feel pain from the needle stick. Other people will pass out, like they have a real strong emotional response to that. And I'm pretty scientific. If you haven't noticed. So I use a lot of, and my clients tend to be overachievers themselves. They like to hear about like the studies and things. It helps them feel safe enough to buy into care with me. And they begin to trust me and that's important, right? I can stop being on guard because she's got it under control. She won't hurt me. She knows what she's doing. So that they don't have to guard themselves. And then we really work on the emotional work. Um, I really like to just focus on the trauma piece, and then help them find adjunctive self-care. I work often with consult with dietitians, and and like PCPs or specialists, depending on what they're specifically needing, because it is a holistic approach to the whole body care.
Yeah, absolutely. What else comes to mind about narcissistic abuse and how that plays into life with a chronic illness or chronic pain?
One of the key pieces that can be kind of a reinforcement for having these chronic issues um, is that less can be expected of them, right? So if you have a family where there's 3 children and one has a chronic, like usually more of this shows up in adolescents and really young children, um, and even adults. If a child has chronic pain, they probably experienced obviously this then emotional abuse, but often that can create resentment between the siblings, um, which is one of the constructs of narcissistic family systems, that nobody can be close. The siblings turn against each other. The parents really feel that. And that can be one of the ways that a parent instigates that, you need to do this for your brother because he says he's hurting. Um, he says he's too tired. That being more of a criticism and used as a weapon. Um, and so when you have a chronic pain condition coming into adulthood, you might see yourself as more burden. And that's just heartbreaking to hear, been so common that they weren't able to do enough for their parents. And that can have them overfunction in other ways too. Like I've seen clients that come in who aren't able to do more physically for their parents. So they give them a lot of financial support or are constantly taking them to lunch or sending them flowers and things. Just trying to contribute in the ways they can to their parents' happiness that they could. And it's such a role reversal.
Yeah. Yeah. The complexity there, I think, is how do we know if we're thinking more functional families now? I do think there is a proper time and place for role reversal as our parents age, but I think that's really tricky when you grew up in a dysfunctional family. How do you conceptualize that? What thoughts do you have about that?
Well, even by the time that they have come to adulthood, they're exhausted from taking care of someone else and then feel a lot of anger. And sometimes this is really the first time they come into therapies. They don't understand why they're feeling so angry at their parent who has cancer now and they're in their 70s. And now they aren't. We would, I think they feel social responsibility, and this is within their personal integrity that they should, that's what they say, care for their aging parents. And I think a lot of us feel that way. Um, and but they also feel this disproportional burden. Like, no one's ever done this for me. They like left me at home alone with the flu for an entire week. Um, when I was 8 or something like that, like you might hear these kind of exclamations of like, this isn't just. No one's ever cared for me. I've got children I'm taking care of, and now my parents. Um, in the work there in therapy I do with those clients is it's important for them to live within their values. And we have to help them determine, like, okay, what part of this is your values and which parts of these are driven by guilt and shame. So it might be, I take my mom to her chemotherapy, but I also don't spend all weekend with her, just sitting with her. Or, um, I arrange transportation for her. If I truly cannot do it all. I share some of this with my siblings. Maybe they get snow at their parents' house instead of shoveling it themselves. They might say, I feel like I'm supposed to help with this, but I don't want to be in proximity, so I'll pay a snow removal service because that's what my values tell me to do. But often the message from the parent is like, oh, you're just so busy, you don't have any time for me. And that compels them to do more. Just really sorting through that. What is the message I'm getting from my parents versus what I need to do to be in integrity with myself?
Yeah, perfectly said. Yeah, it sometimes can take a while to get to that, to clarify values and understand the difference between guilt and shame versus what's important to me and leading from a place of, how I want to live rather than how I don't want to live. It can take a while to get there.
Yeah, and that's often communicated with like, um, so and so's son always comes and takes him to lunch on Saturdays, and that really speaks to the taught value that children are expected to behave in a way that makes their parents look good. Whereas maybe so and so's mother is a lot more pleasant to eat lunch with.
Yeah. Or they've got them wrapped in the guilt too, and that son hasn't done their work yet to untangle from that. Yeah. Yeah.
Could be either one. We don't know, but it doesn't become that adult son's responsibility to always take his mom to lunch on Saturdays.
Last thing here, can we talk a little bit more specifically about maybe the sciencey part of how in my mind, conceptually, visually, I see complex PTSD and chronic illness as the same. And whether that's CPTSD because you had a narcissistic parent or for some other reason, there are other reasons one can have CPTSD, but that's narcissistic abuse is just what we were talking about today. But I conceptualize the two, like I'm very visual. And so for me, it's just watching like a ping pong in the body and the mind, kind of all just doing the same thing. How do you kind of then put that into a more science-based framework?
Well, you're really testing me today. The truth is, we have not fully determined that scientifically. There is, but it's been a real focus of research in the past years, past 5 years. But how I would conceptualize it is, we have internal and external factors that will affect our physiological system on the inside. And what we know is the brain neurotransmitters work on an algorithm that gets set by those factors. And so if we're taught consistently that we're not good enough, or that just hearing that over and over again would make you feel depressed, right? Maybe like helpless, hopeless, all of those feelings, drowning. If you feel that way, you're going to actually experience depression, and the algorithm in the brain is going to be set, those neurotransmitters, to this lower setting. So most of these clients have a low level depression to a point where their greatest hope is to feel safe. They can't even imagine joy and happiness. Like that's like a figment to them of their imagination, or like something meant for other people. Their greatest hope is to feel safe. And that's just neutral, really, right? So they always have this low like sense of self. They're going to feel physically kind of low. And then the physiological expression within the body is also going to mirror those same emotions, right? Because the chemicals in the body are being expressed in response to those emotions.
That makes sense. Yeah.
Coming soon with more research, I think it's going to be so exciting.
Yeah. Yeah, absolutely. Remind me, you are doing research right now, or you already finished your research?
I actually have 2 things I'm working on right now. I'm writing my dissertation, and fixing to, it's actually going to be a study on mental health professionals who have experienced narcissistic abuse by a parent and the implications that it have in their clinical practice. So I'm doing that, but also I have written an assessment for scaling the severity of narcissistic abuse that I'm doing a Delphi study on to get it substantiated so we can use it clinically. Um, yes, I know. It's so fun to have the tool.
Yes, because really the whole time we were talking too, and I couldn't put the question into words, was like, it is about severity and about, you mentioned very briefly too, we all have some narcissistic traits that are healthy, right? And then it's this level, this severity. Is that what your scale is going to be looking at?
Yeah, the severity of it. And I have had people look at it, and I've had a couple people take it, clinicians, that were really curious about it. I said, this is not evidence-based, and they're really shocked by the severity level that they end up at. Because again, these are over-functioning people, like really overachievers a lot of the time who they're like, I didn't realize that this was affecting me as much as it is.
Yeah, this is
Um,
so.
I know, it's really cool. I love science.
Yeah. Well, thank you for doing that work. And is there anything else that you want to leave people with today about this topic?
Yes. The key to healing this is really about repairing the relationship with the self, because this people who experience this, they're taught their role and their purpose is for the benefit of others. And we do some of that, I think, socially. But we have to take care of ourselves first, and that you deserve good care, to be work in progress. And working on your relationship with yourself, no matter if you have a strong sense of self and a strong identity and a belief that you're good enough, when someone gives you a message that does not align with that, you won't internalize it, or you'll be able to accept it as maybe contextual feedback in that moment, but not tied to your identity or worth. And so really focusing on that is, so that's what the work is in therapy, that it's actually the root of the healing.
Yeah. Well, thank you so much.
Thanks for, it was fun.
Good. Good. I'm glad.